name is Alfonso Barrera. I'm a plastic surgeon in Houston, Texas. We're going to focus today on answering frequent questions that patients have when considering a facelift, which, by the way, is one of the most common procedures in my practice. Patients frequently ask if they're a good candidate for a facelift or if they're in the right age group. My answer to them is people age differently. Some people look older at a younger age, some people look younger at an older age. It kind of varies from person to person. But if you're in good health and there's sufficient sagging or loosening of skin on your neck, cheeks or jowl that it bothers you, it can be done. And I've done them as young as early 40s to as old as early 80s. Patients often wonder if there's a need for general anesthesia when you undergo a facelift. And my answer to them is definitely not necessary, and actually it's safer not to have general anesthesia. It's safer to do under sedation and local, which means we give an IV, and through there we administer a medication to make you a little bit sleepy, then give you local anesthesia, and at the end of the surgery you wake up very quickly and are able to go home within about an hour or less from the end of the surgery. And the most important part of this is safer. Sedation local is safer than having general anesthesia. After your facelift, there is no need to stay overnight. I do all of my surgical procedures here at our accredited surgical facility within the office, allowing the patients to go home the same day and with minimal to no pain. After your facelift, we will apply a bandage around your head, just basically wrap it around this way. Of course, this area will be uncovered. There will be minimal to no pain when you leave the office, and generally you leave within an hour or less. The next day, I do want to see all of my patients for follow-up. There often will be one little thin drain that I remove, which enters behind the ear and goes to the other side. Take it out the next morning. And at about 1 week, I will remove a lot of the sutures, and then the remaining sutures come out at about 10 days. As far as going to work, I tell most of my patients, if they are worried about going to work as soon as possible, to plan on doing it on like say a Friday, take the weekend, the next week, and the next weekend off, and then go to work. At that time, there might still be a little bit of bruising, but you can most of the time camouflage it with a little bit of makeup. As far as exercise, I would wait about 3 to 4 weeks before working out. Walking is fine, even within a couple of days you can start walking, but we don't want to do anything strenuous. Patients often ask or wonder if there are going to be visible scars after a facelift, which is a great question. I always make emphasis in hiding them as best as possible, and generally they're quite undetectable. At the same time, I make sure to preserve all the hair, not create any hair loss. After a facelift surgery, amazingly, for my patients, at least my patients, I can tell you that there's minimal to no pain after the surgery, and certainly there's no pain during the surgery. Patients are very often surprised how little pain there is after the facelift and eyelid surgery.